is West Michigan Live with Neil Dion on News Radio Wood 1300 and 106.9 FM.
Well, chances are, if you suffer from occasional aches and pains, and who doesn't, you probably have a bottle of acetaminophen in your medicine cabinet. This pain reliever, most people know as Tylenol, can help a headache, ease chronic joint or body pain, and even reduce a fever. But one thing most people don't realize, that along with physical pain, acetaminophen may also dull your emotions. A new study published in the Journal of Psychological Science suggests that this popular drug could dampen a person's emotions, both good and bad. Now, this is something to consider, and I'm just not sure whether we're being affected in a good way or a bad way. So I figure the best thing to do is invite in Dr. Al Johnson of Johnson Medical Associates, an internist who's well-versed in this subject. And we all take Tylenol without a second thought if something hurts, if we got a boo-boo. Dr. Johnson, does this have other consequences, perhaps?
Well, most medicines do have side effects of some sort. Some people, it affects more than others. And in this study, they gave acetaminophen to healthy individuals to see what type of effect it would have on that healthy individual on their emotions. And this was done at Ohio State. It showed that it did blunt the highs, and the joy, and it did blunt the negative, the depression part of it, which is not unexpected because pain medicine works on the brain. The brain is where you have feelings and emotions that start from.
So in some people this might work as an antidepressant, but in someone else's physiology it could do the opposite?
Well, no. In this place, it works more as a depressant. It's a downer.
Okay.
So pain medicine typically are downers, and it blunts just response. It blunts pain response, and it blunts emotional response. And that's why you see drug abuse out there, abuse of prescription medicines to blunt people's feelings when they really don't have pain. They're just using it either as a recreational drug or they're addicted to it for other reasons.
Yeah, it seems like there's almost always a downside to just about any medication that we've discovered, isn't there?
Exactly, and that's why I encourage people to read the labels, follow the directions, don't abuse it, don't take it when you don't need it. If you're having chronic problems, then seek medical help to figure out what's going on. I see people every day in my practice that have chronic problems that aren't responding to different medicines, and we look at underlying causes. You know, is your headache due to allergies? Or is it due to something you're exposed to? Is it due to the poor air quality indoors from mold or contaminants? So it's important to look at the causes of what's going on and try to find the causes, and then to be careful and follow instructions on pain medicines and other over-the-counter medicines.
You know, if you look at our past and our history, and I'm a lover of history, and as I look back a century or two ago, you notice that so many people died from alcohol poisoning, for example, or abuse of a well-known drug back in the day, laudanum. And I suppose that most people were just using that for pain because at that time that's all they had, right?
Yeah, exactly. And so they were, you know, self-medicating, as you described, and you can overdose from it. And then, of course, before alcohol was controlled, there was the alcohol that was not correctly made that was toxic. And so you'd get liver toxicity and die from it because it was not the grain alcohol. It was petrochemical type alcohol or other alcohol.
Yeah, one interesting thing from this study that got my attention was the fact that half of a group was given acetaminophen, the other half a placebo. And they noted that the vast majority of those who were shown delightful photos, for example, did not carry over the joy that one might expect from looking at happy pictures. Isn't that kind of
exactly
odd? I mean, the way our brain works?
Well, I think that was the group that was given the acetaminophen that blocked that response or dulled that response. And, you know, when you take medicines, they do have adverse effects. And most pain medicines affect the brain in a way that it dulls its perception, whether it's pain or what you're looking at. Now, if you're having pain, like headaches, and take the medicine, then it relieves the headaches, and you, of course, feel better and can experience other emotions in a more delightful way without the effect of the pain.
Another finding in this is a professor of psychology at the University of Kentucky who worked on this study said typically we think of acetaminophen as numbing painful experiences. Instead, the study suggests that the drug may have a broader impact by muffling all emotions.
Yeah, exactly, and it's a global effect that it has because it's marketed as a pain medicine, but we know in the medical field that the medications are just not that specific, that they cover a much broader area, and many times in drug research, the medicine is looked at for one type of problem and is actually marketed for another problem because they found out it was more effective in that area.
I see. Now, we're all familiar with Tylenol. We're all familiar with ibuprofen or Advil. How does plain old unsexy aspirin that our parents and grandparents used to take, how does that play in this? Do we have any information on its relation to changing emotion?
Not at this time. This is kind of an unusual study that was done by grad students, and they're looking at doing other studies on it. So we don't know exactly from a comparison standpoint how it stacks up to acetaminophen in its global dulling of the emotions.
Let me ask you this. I know that you physicians always have to stay up on the latest things, and you know what's often in the pipeline before we ever hear about it. Is the medical community satisfied with the pain relief that's being provided to people through acetaminophen and ibuprofen and the like, or are they still trying to develop that new thing that may come with more benefit and less downside?
Well, I think the drug companies are always looking for new and better ways to treat people, to provide medication that's effective, both from a cost standpoint and from a medical standpoint. So there sure can be new ones coming. I don't know of any right now from over-the-counter aspect of it. But if you have chronic pain and it's not being resolved, it sure makes sense to get medical help, see what's the underlying cause of it, and then if there's a better way to treat it with less side effects.
Are pain specialists or pain clinics, do you think, a good alternative if these things are not helping a person?
Yes, that's their whole purpose is to help people deal with pain. But it's important to try to figure out what's causing your pain. Mm-hmm. You know, is it an old injury, or is it something that you're exposed to, or something that you're eating, like chronic headaches? A lot of times they're due to environmental factors, allergies, both indoor and outdoor, chemical odors. You know, I have numerous patients that react to perfume that flares up their headache and causes headaches, scented products. Huh. So it's important to really, as an individual that's having chronic problems, to ask yourself those questions and be more observant.
Interesting. I've never thought of that before, but I guess that is a real thing.
Most definitely.
Well, here's another example, and I only have a minute or a little bit less, but it just occurs to me all these peanut allergies, and I know this is not really your area of expertise, but we never heard about such a thing when we were growing up, but only as an adult do I find out that half of the world is very sensitive to this, and they don't even hand them out on planes anymore.
Exactly. And I think part of the problem is, and it has been proved in many studies, is that there's a decrease in breastfeeding. And when you ingest breast milk as an infant, you get small amounts of all the food mom's been eating. And so you build up tolerances to those.
I see.
Now it's strictly formula, which is limited to what's in the formula, and you aren't exposed to those as an infant. Therefore, you don't build up the tolerance to it. So I think there's a reason why we're seeing all this.
Yeah, makes perfect sense to me. Dr. Al Johnson, thank you so much. Pleasure to have you on the show with us. Dr. Al Johnson, Johnson Medical Associates. Pleasure speaking with you. Thanks for joining us today on West Michigan Live. Enjoy this beautiful day. See you tomorrow at 9 on West Michigan Live. News Radio Wood 1300 and 106.9 FM.